My name's Andy Avila.
My name is Sibongile Rumumba.
Hi, my name is Terry.
I'm Casey.
My life before weight loss surgery was pretty sad. I was dealing with numerous health problems. I was in a dark place emotionally. I was suffering from depression, compounded by the health problems I was having. I was having heart trouble, I was diabetic, high blood pressure. I was having skin conditions, developed because of my obesity. And all of that in turn brought me to a very dark, sad place, I would say.
The reason I finally decided to get weight loss surgery is I stepped on the scale and I was almost 400 pounds. And it just kind of was like a sobering moment.
I had a lot of back problems, and they told me the only way I was going to get it better was to lose weight. And I tried multiple diet plans, and I would lose and lose, but I'd hit about 250 and I couldn't go below it. The scale would not move, no matter what I did.
I had gotten pretty big. At that time, I was approaching 300 pounds, and that was a lot to look at. And I had tried exercise, I had tried everything, and I knew if I'm gonna do something, I need something that's gonna stick. Especially after 3 children, it gets harder and harder and harder to lose weight, so.
And you just go, something's gotta change. And we both had the sleeve done 2 years ago on the same day.
Went with the duodenal switch.
He performed a sleeve on me back in July of 19. Once I met Chuck and once I sat down and I saw him face to face, all my worries kind of just subsided. I felt immediately comfortable.
We got referred to Dr. Apakama by the first doctor we started going to.
The first weight loss surgeon we went to.
And ended up just being a godsend because he turned out to be a great doctor and a great surgeon.
I felt that what he was telling me was truly because he cared and he knew he could help me change, and I believed him.
My first impression of Dr. Apakama, I have never had a doctor that actually sit down, cared enough about you that he would say, why are we doing this? What's going on? And sit down and draw and make you understand in layman's terms what's going on, what we need to do, how we can change it.
Dr. Apakama was very caring, considerate. He would remember you, he would remember discussions you've had, so you're not just a number on his papers. You're actually a person he's dealing with, and he's considering you and, cares about your health.
I was on 2 blood pressure medicines, and now I'm off of those. And I have a lot more energy.
I live in an apartment and I could walk around my building and that was it. Then I walked around my building a couple of times and then I walked down the street. And I remember the first time I walked 20 minutes and I walked it. Then I remember the first time I jogged 1 mile without stopping. And then I remember the first time I ran a half marathon. And all of this has happened in a year and a half. I've lost just under 170 pounds. I'm in the best health of my life at 40 years old. My son, I feel, has the best father he could have.
I'm off all my medications. I was diabetic. My A1C went from a 7.1 to a 5.6. I no longer take high blood pressure medicine, gout medicine, more active.
I am now not that tired. I'm able to be active. I can spend the whole day on my feet without feeling exasperated, without dropping down or anything. I can fit into certain spaces I couldn't fit into. There's a lot of things that have been unlocked for me, with that. I can fit into certain clothes I couldn't fit into anymore. It's just a relief. It's just seeing the progress is a great relief. So the journey has been, it's been phenomenal.
Somebody who cares, and you truly see that in his work and in his job.
So anybody thinking about doing it, I would 100% recommend it.
Yes.
The risk is very minimal.
The reward is 100 times better than what the risks were. There's no way I would ever want to go back there knowing how I am now.
I couldn't think of anyone else I would recommend. Anyone else. Chuck